All right, I'm going to go ahead and get started. So good morning, everyone. Welcome. Again, thank you for being with me today. I am Vicki Howard, Product Manager and Certified Clinical Physicist here at Standard Imaging. Throughout my 20+ years in the clinic, I have had the great opportunity to witness many incredible advances in radiation oncology. So with that being said, I completely understand how demands on clinical physicists today have changed throughout the years. Physicists are now an active part of direct patient care through their involvement in many special procedures and often support multiple clinics. So these added responsibilities significantly increase a physicist's workload. So in the face of these challenges, clinicians need to be empowered to work smarter, not harder. So this is the goal of Standard Imaging's patient QA solutions, and really is what fuels my passion as a product manager and former clinical physicist to really focus on improvements in this area. All right, before I get started, there are a few housekeeping notes from our team. Today's webinar will be recorded. You will receive a link to the recording, but you can also find access to this webinar and all of our previous webinar recordings on our website at www.standardimaging.com. Please enter any questions in the GoToMeeting dialog box at any time, and I will do my best to answer them at the end of the presentation. And for those of you who don't already know, Standard Imaging is based in Middleton, Wisconsin. I myself am located in North Carolina. We were founded in 1989, and we design and manufacture a full suite of QA products for radiation therapy. Today, I will start with a quick overview of how our comprehensive patient QA solutions work hand in hand. And then I'll dive deeper into the new features of Adaptivo version 2.0, which I'm very excited about. Standard Imaging offers a comprehensive set of patient QA software solutions that span end-to-end quality assurance for your patients. These span from Monte Carlo-based, I am sure, treatment plan second check software, our LinAcView log file-based machine performance solution, and then finally, Adaptivo, which is our EPID-based patient QA solution, which offers both pre-treatment and in vivo QA. So the graphic on the left is a great illustration of how these three fit together and work hand in hand for your patients. Today, I will focus on presenting an overview of Adaptivo, represented here in green, showing the patient in place for this QA process, for the QA process, and using the EPID anatomical. I will highlight the new features of our latest release. So we're all familiar with pre-treatment QA, which is performed either in air or in a phantom using film and chamber, a detector array of some sort, or EPID field portals to verify the field shape and dose fluence. These QA options have been useful over the years. I used many of them in the past. However, they all leave out one very important factor, the patient. In these cases, if the pre-treatment QA is less than desirable, it can be really challenging for the physicist to relate these differences to the dosimetry implications within the patient. So it can be really tricky to really have quantifiable information for that go, no-go decision for a particular plan. When it comes to QA for daily treatments, many are insensitive to changes in internal patient anatomy, such as surface-guided radiation therapy, or they're subjective and are delayed. For example, daily or weekly cone beam CT or EPID imaging has no real-time quantifiable indicators, forcing a purely subjective review by the physician. And in many of these cases, daily cone beam CT, the physician is having to make these assessments and decisions while the patient is laying on the table waiting for the treatment to be delivered. Moreover, weekly physics chart reviews lead to potential delayed reactions to issues associated with potential anatomy changes. And again, this qualitative review is subjective, and in some cases, it's often beyond the scope of the physicist's level of expertise. As I mentioned, Adaptivo offers both pre-treatment and in vivo QA solutions. So I'm just going to quickly touch base on our pre-treatment dose QA. Adaptivo's pre-treatment QA module offers an easy EPID-based QA solution, which compares predicted versus measured EPID images prior to delivery to the patient. This process verifies planned transfer and delivery with an EPID dose measurement in air, so there's no phantom required, making it easy for therapists to assist with pre-treatment QA. Before I dive deeper into the In Vivo QA module, I want to give a quick overview of the requirements and benefits of In Vivo QA. Requirements for Adaptivo's In Vivo analysis are the files from your treatment planning system, such as the RT plan and planning CT, a pre-configured beam model customized to your LINAC, machine records associated with the treatment delivery, and lastly, corresponding integrated EPID images. In the United States, the majority of patient QA effort is focused on pre-treatment QA. However, In Vivo has many benefits, which include quantifiable measurements during actual delivery, the ability to QA patient alignment during treatment, and monitor the dosimetric impact of anatomical changes. All these items help to ensure accurate dose delivery to the patient for every fraction. Adaptivo's 2D in vivo verification module provides real-time QA analysis for every fraction through daily exit dose tracking using the EPID. It has the ability to capture setup and delivery errors, as I mentioned, as well as changes in patient anatomy that affects dose, such as weight loss or a change in tumor size. All of these are important in evaluating quality and the potential for adaptive therapy actions for your patients. And of course, with the trend towards higher doses, smaller targets, lower fractionation, this is more and more important. There are two modes available. The predicted mode, which does require an adaptive beam model that comes pre-configured, and this is used to predict the expected transit dose through the patient reaching the EPID. And the second is the relative mode, where the reference transit image can be used for comparison. So as a user, you can flag, say, treatment image number 1 as your reference image, and then look at trends from that point forward. Or you can choose whatever image you deem suitable for that reference. In each of these cases, gamma comparisons are automatically calculated for every treatment field as soon as the patient's treatment is complete. So here you can see in the little image on the right, it shows a summary of the analysis of each fraction and each treatment field. So this particular image is from a snippet from a lung treatment where there are 4 arcs. You'll see at the bottom are colored rectangles with gamma values displayed in them. So these colored rectangles are set that the green means passing, yellow is a warning, and red represents a failing result. The system can be set up to alert physicists automatically via email or within the software that these alerts have occurred to bring attention to where it's needed. As I mentioned, the quantitative gamma results are also displayed here for easy review. You can kind of quickly look at trends. So even if you have a passing result, there may be an underlying trend that just a quick view here you can look at. And I'll show you a little later that there is a portion within the software where you can view those trends graphically. Of course, the pass, warning, fail thresholds and now that I've given you a general sense of the software, I want to take some time to discuss the new features of Adaptivo version 2.0. The overall goal of the new version was to first expand the ability to process more clinical cases and to provide enhanced evaluation and assessment tools. We have accomplished these goals by adding several new features. We now have the ability to calculate relative mode gamma results for flattening filter-free beams, and this gives users the ability to track any changes that may occur with the treatment deliveries that are often associated with much higher doses and shorter fractionation times. Of course, these factors make it even more important to know if there's an issue over time with each planned delivery. Next, we've incorporated automated analysis of interrupted treatments. This feature is also really important in a lot of clinics these days, as many are starting to incorporate third-party interfaces such as surface guided radiation therapy software, which has the ability to pause the beam during treatment. Say if the patient moves out of tolerance, the beam will pause. The treatment will not terminate, it'll just be paused, and when the patient gets back in position, the beam will resume. However, in this case, the image acquisition will be terminated. So Adaptivo now has the ability to recognize and flag images from interrupted treatments, as well as pause deliveries. So EPID images acquired during an interruptive treatment can be the result of pauses or machine faults, and they're now automatically consolidated and analyzed. So I'll dive further into some of these details in the next few slides. Other improvements include more accurate EDW predictions, flexible gamma analysis tools throughout the software, and interactive assessment tools, which gives the physicist the power to focus in on areas of dose discrepancies so you can make more informed decisions. So this is an example which illustrates how Adaptivo handles an interrupted treatment due to a machine fault. So as you can see, we have a red flag. Shown here with a half red, half white rectangle for the delivery. So the half colored, half white rectangle is representative of an interrupted image acquisition, and the analysis is either on partial image or, once it's completed, the full image. So as you can see from the DICOM import summary information on the right, we have one acquired portal dose image in this case, 60.78 monitor units or meter set exposure was acquired. We have one RT record, and we had a planned monitor units of 234.3. So obviously this was an interrupted fraction. There is, because it's very important that physicists are notified of these kind of interrupted deliveries, and must say in most cases within record and verify system, that's not the case actively. Usually it was the therapist who would notify physics that there was an interrupted treatment, and we followed up to make sure that that treatment was completed at a later time, either hours later if the machine went down or the next day. So here you can see we have two written warnings. The first is the treatment delivery may be incomplete. The total delivery meter set for the RT records is less than planned by 2 or more monitor units. So that is the deviation limit for that incomplete delivery flag. It also is telling you that the portal dose image may be incomplete. The total meter set exposure of the images is less than planned by 2 or more meter set.
Clicking on the Details button, we can dive a little deeper into this information. Here we can see the acquisition date and that only a portion of the monitor units were delivered. We can also see that there was only one associated RT record and that the interruption was due to a machine fault. The next slide will illustrate the completion process. When the therapist completes this treatment at a later time, be it minutes, hours, or days later, Adaptivo will again alert the physicist that there are 2 images from 2 RT records that have been consolidated and a recalculation is required. Again, the Details button shows the remaining monitor units were delivered successfully as a continuation of the original fraction.
Okay, now on to the next example where we have a beam pause. So in these cases, you would very likely have multiple beams, but only one RT record because you never really terminated that particular treatment. It was just paused. So in this case, you do still get an alert. But if we look at the Details button here, you can see we do have 2 portal images. Here you can see that even though the beam was paused, and we do have multiple images. The first one was 88.03 meter set exposure related to it, and the second image was the final 146.27 monitor units delivered, or meter set exposures, how we refer to it, that was delivered to the panel. So in this case, you can see we only have one treatment record, and the treatment termination status was normal because it was only a beam pause. Adaptivo does automatically consolidate these images and will show visually, based on half-colored, half-white rectangle, that it was an interrupted image, but the gamma analysis will automatically consolidate these two. So the gamma analysis will reflect the completed fraction. Okay, next I will talk about the improvements in our interactive assessment tools. So as part of the plan review or image treatment review, you have the ability to look at hot and cold gamma over a reference portal, and you can view the associated dose profiles from the expected versus delivered, wherever you have it positioned. So with our previous version, the dose profiles defaulted to X and Y equals 0. But now the user has the ability to move the cursor, and the profiles will automatically updated to whatever XY value it is centered at. So this is really helpful in cases where you do have hot or cold gamma that is off axis. Then you can easily go and kind of zoom in on that area. It's a very, very useful tool. Okay, so now that I've highlighted some of our main features that have been added and given you a general overview of the software from pre-treatment and 2D in vivo perspective, I want to go over a case study from an actual case from one of our customers, Brian Pomage,
where they use the information from Adaptivo to make more informed decisions about adaptive therapy, and it allowed them to get alerted when automated changes began to affect patient dosimetry. So here we have a lung treatment with 4 arcs. The image on the left shows a treatment cone beam CT with the CT planning structure set overlaid on it. As you can see, there have been some changes within the patient. During CT planning, the patient had fluid in their lungs, and now the fluid has cleared. There has also been some tumor regression, which is good for the patient from their perspective, but perhaps not from a treatment and dosimetry perspective. And also, the patient appears to have lost weight. What is important to note here is that looking at this CBCT image, it's not clear if there is a significant dosimetric impact as a result of these anatomical and weight loss changes. To get a clearer picture of this impact, we can look at the daily gamma analysis result for the treatment fields. Here we are looking at a subset of fractions from fraction 31 through 37. Each column is a fraction, and each row represents arcs 1 to 4. Things looked relatively good through fraction 35, aside from arc 4 having results in the warning range. However, at fraction 36, the gamma results looked worse for all arcs. The shift was enough to alert physics and physicians to take a closer look at the analysis data.
So if we look at the particular fraction 35 for the 4th arc, you can see that there are hotter areas due to the changes in patient anatomy, which was tumor regression and weight loss. And then also some of that was the fluid. So if we look more closely as well at the dose profiles, you can see that the measured dose to the EPID was greater than what was predicted. So this confirms the fact that more dose is transiting through the patient and hitting the EPID panel rather than being deposited within the patient and in the tumor where we want it to be. But now this view, I think, is an even more meaningful view. So this is showing weekly average values over the course of 5 or 6 weeks. So as you can see from here, probably up through fraction 20, 21, everything looked pretty good with all 4 of the arcs. However, things started trending off, looks like around the 6th week. You saw first with the 4th arc, but the others were, even though they're passing, they were trending down. So it's very helpful to look at the trend alongside sort of the colored in your alerts, because some of the trends may be hidden in the region of your flag, but they do exist. So here you can see by the time it reached fraction 38, all 4 results from all 4 arcs were trending off, either in the warning or fails zone or borderline warning. So in this case, Adaptivo did a great job alerting the staff that there were significant changes to the patient's anatomy, including weight loss, tumor regression, and a significant decrease in the fluid within the right lung. And yes, you can see some of these changes within the cone beam CT that I showed you. However, there was no quantitative information related to that. So it's very helpful in decision making to have that information. Based on the information provided by Adaptivo, the physician did decide to discontinue the initial plan early, and they re-CT'd and replanned the patient's boost. So the physician was able to increase the boost daily dose from 2.5 gray, and they had a smaller target volume, so they could increase that dose. So the end result is really a significant reduction in the treatment volume and an increase in the tumor dose and a reduction to dose to the normal tissue, because they were able to adapt to the changes within the patient. So that's it for my overview. If you have any questions, feel free to enter those. I'll give everybody a few minutes. Also, if you're interested in seeing more of a live demo perspective, feel free to reach out to your sales representative, and I'd be happy to set up a personalized demo for you and your team. Okay, I do have one question. Any concern about collisions with the EPID? Yes, there will be some scenarios if you have, table rotations where that might be a concern. So you do have to be mindful of which plans it's applicable to, or which particular beams for that scenario. So yes. The next question is, do you verify accelerator changes? I'm not quite sure what that is referring to. I'm thinking perhaps it's another. That could be the case. Let's see, sorry, let me look. Yes, in that case, as long as the beam energy matches, Adaptivo will still grab that RT record, and it can generate and if it's the same kind of accelerator, it can generate a gamma analysis from that information, but there is no, we don't link it to a particular accelerator. So as long as the patient shifts for treatment onto another machine, it's able to recognize it still as the same. It's using the information from the record and verify system, so it will recognize that completed images perhaps from the same RT record. So I think I get to understand where you're coming from. If you have a machine going down, patient only received a portion of their treatment, they go to another accelerator to complete that treatment. So yes, that's covered. Hopefully that answers your question. Another question is, can you do monitoring less frequently instead of daily? Currently it's set up to just automatically grab the RT record and the images. But if you want, so it is just doing this all in the background, so it really isn't adding any additional tasks or work from a physics perspective. But if you want to look at just trends on a weekly basis, then that's an option. You can set up how you want your averaging to happen, how you want your reporting to happen. So you can do reporting on your weekly, that sort of thing. And next question, does the extra usage of the EPID affect the lifetime? We do get that question. You know, the newer EPIDs that are available now are much more robust than the ones from, you know, the early days. We do have customers who use this day in, day out for their customers, and they have reported no issues with their EPID. They may just need to recalibrate. There is a small, short calibration process that's associated with Adaptivo, but other than that, there's no degradation in imaging that they've found. What is the time delay that the software waits for a beam pause before it turns into a beam interrupt? Actually, that's more on the record and verify side. So, you know, if we have, it's looking for images and the corresponding RT record. So if we have one RT record and 2 images associated with that, it'll just know to piece those together. But if there is a termination on the delivery side, on the accelerator side, the record and verify system is also going to catch that. So all of that delivery information, we're just receiving and retrieving from your record and verify system once the treatment is delivered. So there's no real-time data grabbing at the moment. It's waiting till that treatment record has been written back to your record and verify system from your accelerator. All right, I think I have all the questions. My view is a little funny on my end, so I'm having to scroll down in a little slit of a window to look for your questions. So if I have missed something, I apologize. But you can also reach out to me directly at vhoward@standardimaging.com, and I'd be happy to answer any other questions you have. So again, thank you so much for taking some time today to listen to the improvements we have made with Adaptivo version 2.0. We are still currently in the works of continuing this development, so we're excited about the possibilities for this product. So please, if you want more information, I'm happy to give you a demo. All right, thank you so much, everyone. Bye.